Hi everybody, this video of mine is about ingrown toenails. Ingrown toenails are a common condition in which the corner or side of a toenail grows into the soft flesh. The result is pain, redness, swelling, and sometimes an infection. Ingrown toenails usually affect your big toe. Often you can take care of ingrown toenails on your own. If the pain is severe or spreading, your doctor can take steps to relieve your discomfort and help you avoid complications of ingrowing toenails. If you have diabetes or another condition that causes poor blood flow to your feet, you are at greater risk of complication of ingrown toenails. Now let me tell you some of the symptoms. Ingrown toenail symptoms include pain and tenderness in your toe along one or both sides of the nail, redness around your toenail, swelling of your toe around the nail, infection of the tissue around your toenail. You should see your doctor if you experience severe discomfort in your toe or pus or redness that seems to be spreading, if you have diabetes or another condition that causes poor blood flow to your feet, and you experience any foot sore or infection. Now coming to the causes of ingrown toenail. Common ingrown toenail causes include wearing shoes that crowd your toenails, cutting your toenails too short or not straight across, injuring your toenail, having unusually curved toenails. Okay, let me tell you some of the complications. If ingrown toenails are left untreated or undetected, an ingrown toenail can infect the underlying bone and it can lead to a serious bone infection. Complications can be especially severe if you have diabetes, which can cause poor blood flow and damage nerves in your feet. So a minor foot injury such as a cut, scrape, cone, callus or ingrown toenail may not heal properly and become infected. A difficult to heal open sore that is known as foot ulcer may require surgery to prevent the decay and death of the tissue, which is a gangrene. If gangrene results from an interruption in blood flow to an area of your body, then the situation can be dangerous. Now let me tell you some of the preventive measures. To help prevent an ingrown toenail, you should trim your toenails straight across. Do not curve your nails to match the shape of the front of your toe. If you have your toenails done at a salon, be sure to tell your pedicurist to trim your nails straight across. If you have a condition that causes poor blood flow to your feet and you cannot trim your nails, see a podiatrist regularly to have your nails trimmed. Secondly, you should keep toenails at a moderate length. Trim toenails so they are even with the tips of your toes. If you trim your toenails too short, the pressure from your shoes on your toes may direct a nail to grow into the tissue. Third, you should wear shoes that fit properly. Shoes that place too much pressure on your toes or pinch them may cause a nail to grow into surrounding tissue. If you have nerve damage to your feet, you may not be able to sense if your shoes fit too tightly. You should take care to buy and wear properly fitted shoes, preferably from a shoe store specializing in fitting shoes for people with foot problems. The next is that you should wear protective footwear. If your work puts you at risk of injuring your toes, wear protective footwear such as steel-toed shoes. And lastly, you should check your feet regularly. If you have diabetes, you should check your feet daily for signs of ingrown toenails or other foot problems. Now coming to the diagnosis and treatment. This condition can be easily diagnosed when the patients come to us based on the symptoms and a physical examination of your nail and the surrounding skin. Now let me tell you the treatment. If home remedies have not helped your ingrown toenail, your doctor may recommend lifting the nail. For a slightly ingrown toenail, in which redness and pain but there is no pus, we usually carefully lift the ingrown nail edge and place cotton or dental floss or a splint under it. This separates the nail from the overlying skin and helps the nail grow above the skin edge. At home, you will need to soak the toe and replace the material daily. Then there is an option of partially removing the nail. For a more severe ingrown toenails in which there is redness, pain and pus, we may trim or remove the ingrown portion of the nail. Before this procedure, your doctor may temporarily numb your toe by injecting it with an anesthetic. Then there is the option of removing the nail and tissue. If you have the problem repeatedly on the same toe, then we may suggest removing a portion of the nail along with the underlying tissue that is known as nail bed. This procedure may prevent that part of your nail from growing back. Your doctor will use a chemical, a laser or other methods. Now coming to some lifestyle and home remedies. You can treat most ingrown toenails at home, and I will tell you some of the steps. First of all, you should soak your feet in warm water. Do this for 15 to 20 minutes 3 to 4 times a day. Soaking reduces swelling and it also relieves tenderness. Secondly, you should place cotton or dental floss under your toenail. After each soaking, put fresh bits of cotton or waxed dental floss under the ingrown edge. This will help the nail grow above the skin edge. Then thirdly, applying antibiotic cream. Put antibiotic ointment on the tender area and bandage the toe. Then you should choose sensible footwear. You should consider wearing open-toed shoes or sandals until your toe feels better. Also, you can take pain relievers. Over-the-counter pain relievers such as Tylenol, ibuprofen, and naproxen sodium may help ease the toe pain.